I'm happy that I changed my proportions. I'm happy that I didn't go further. I'm happy that, to be honest, I don't have like serious complications. So, in my opinion, this surgery is really good. It's really good. Changed your life. So I came here to Livelifetaller to fix a little bit my height.
Okay. Okay. Guys, welcome to our channel. So I have here a great and special patient because he's a surgeon as well and an active surgeon who's performed surgeries, right?
Yeah.
So, okay, bro, first of all, who are you? I mean, you are a surgeon. What kind of surgeries you are doing? Can you explain a little bit?
Yeah, of course. I'm a plastic surgeon. I'm from Peru. I live in Lima. So yes, it's far away. Most of the time I do like rhinoplasty. It's like most of my time. So I came here to Livelifetaller to fix a little bit my height.
Okay. Okay. Okay.
Yeah, and that's it.
So you are doing rhinoplasty. I saw also on your Instagram you are doing liposuction.
Most of the time I do rhinoplasty. I do like a few liposuction. I'm most focused on the rhinoplasty and face surgery.
Okay.
Yeah.
What was your height before the surgery and what is your current height?
My current height is 176.2, right?
Mm-hmm.
0.2. My original height was 169.9, I think so.
Okay.
I don't remember that much, but it was 169.9, I think so.
Okay.
So yes, I did Precice on femur. I have the Precice here in my right now. I have the Precice. I did 6 centimeters in the Precice, so I'm happy.
Quick limblengthening surgery, change your life. But the most important thing is that you are happy right now.
Yeah.
The centimeters doesn't matter, to be honest. The most important thing that you are happy. But another important point, Tony, so that patient is thinking like, okay, there's focus for the limb lengthening on centimeter, but I say always the centimeter is just a good side effect of this job, of this procedure. The most important thing is the body proportion. Your whole proportion is changing. Not be focused on the centimeter, more be focused on the body proportion. So as he said, the most important thing is that the patient is also happy, and that was his goal, because I know some patients will ask why he not reach 8 centimeter. He pay money for that, and why not 8?
Mm-hmm.
The most important thing is for sure, as a surgeon, he say, I think that's a safety zone for me, and also that you are happy with the result.
Yeah, I think that each patient has their proper goal, it's different. Maybe some of them, one patient wants 10, 8, 6. I think that each one has to think about it. Yeah. Think about, if you're in the safe zone or you're in the risk zone. Mm-hmm. I prefer, to be in the safe zone, run, work as soon as possible. So that's why I prefer to get to 5. And when I was in 5, I said, okay, we can go to 6, Yeah. I think that when you have like a lower goal, then when you get to a little bit further, you are like happier, I got more than I expected. So that's why I decided to be like low and then do it further.
Awesome.
I'm happy, because when I arrived here, we were doing the consultation, and I remember, I was with the same shirt, with the same blue jeans. I remember that when I was looking at you, you were like a little bit like taller than me. I said, oh, okay, I'm gonna pass this guy.
Yes, you already did it, by the way.
I'm gonna pass it. So right now I'm happy with my result. To be honest, I'm happy. I'm happy that I challenged my body. I'm happy that I changed my proportions. I'm happy that I didn't go further. I'm happy that, to be honest, I don't have like serious complications. I only have a little bit of numbness, but it's going to pass.
Absolutely normal.
Yeah, but I think it's a good experience, And I think that the most important thing of this situation is to be really, really mental strong, bro. Yeah. The thing that actually breaks you sometimes is to be mentally strong. You have to be really mentally strong, and you cannot understand a patient of limblengthening surgery if you are not a patient.
Yes, that's the point what Livelifetaller makes special, bro. Because you are a surgeon. So you are doing, for example, nose, but you are doing it thanks to you, people's nose looking better. Mm-hmm. But you cannot understand the situation if you never did the nose on yourself.
Yeah, that's it. Everybody has their own goals. I have, friends that actually they want to go further. Yeah. I respect their opinions, but everybody is different. I think that we have to respect the body. We have to respect our height. Most of the people wanted to born, with 190 centimeters, but it's not like that. So if we want to change, if we want to do changes, I think that we have to respect our body,
Definitely. Also, I did my nose. Please, also, we can also post my nose before and after. So, I was not going to doctor and say, please make my nose 2.4 centimeters shorter, because you, as a surgeon, you have to make the best nose for my face, right? So this is the same. The limblengthening surgery is also the same, guys. Please, if you are doing the surgery with us or not be focused on centimeter, be focused on the result, because the limblengthening's original goal is to change your full proportion, and the centimeter is only a good side effect of that. How was the limblengthening surgery for you? But please answer me as a surgeon.
Okay, the first time I researched a lot. I think that this surgery you have to be educated. Okay. You cannot come, just like you are doing like a tattoo removal. Okay. Yeah, you have to research about the surgery, because it's going to change your life. It's going to change for good. Of course, if you stay in the safe zone and go to a good place, but for bad if you make bad decisions also. So, in my opinion, this surgery is really good. It's really good. Change your life. Also, like the rhinoplasty, like the liposuction, but this is something that you cannot buy. You cannot buy tall. You cannot buy centimeters. You can buy a car.
Yes.
You can buy a house. Yeah. Okay. You can buy many things, but for example, you can have money, but you want to be taller. Okay, I want to be taller, but you have to cross that line of doing the surgery, bro. Crossing that line is so hard, because remember, they are breaking your bones. It's not easy. To be honest, I had pain. I had bad days. I had good days. It wasn't easy. It wasn't easy, especially the first week. It wasn't easy. But I know before the surgery that it's not going to be easy. If you come like everything's going to be easy, and then you see that it's not, that actually you're going to feel pain, I think you're going to get surprised. You need to know that this is the femur is the longest bone of the body, and if you break it, of course you're going to feel pain. It's not going to be like.
Of course, it's a human body.
Yeah, of course, it's just it's logical. You need to hit. You will feel pain, and of course I think that this surgery is risky. It's risky, but as many surgeries, when I do rhinoplasty, also we have a risk. When I do liposuction, we have a risk, of course, yeah. But I think that if you go to a safe place, if you go to a safe expectations, if you don't do over lengthen, you can reduce, the risk, because of course, yeah, you can get like a blood clots, you can get fat embolism, you can get infections.
Sure.
If you want to reduce that risk, in my case, I choose a Precice. Yeah. I choose the Precice because I want to reduce the infection. Yeah. Okay, now I have the blood clot and the fat embolism. I have to move a lot.
Sure.
The fat embolism.
That's important, right?
Yeah, in the fat embolism you cannot control. Also with liposuction you can get a fat embolism. Yeah. Well, it's not usual. It's very rare.
Yeah, it's not usual.
It's very rare. It's like so unusual. But it's like going to a plane.
Yeah, exactly. It's general risk. Yeah. Not like every 5 patients or every 10 patients will happen. Yeah. So we had 4,800 limblengthening, you also a lot, otherwise for sure you cannot continue this kind of business.
Yeah,
but risk, bro, we say in German, to live the life is risky. You understand me, right?
Yeah, I know.
To live if you go today to outside, you don't know, maybe you will have an accident, you can die. But as you said, the most important thing is also surgeon experience, and especially aftercare what limblengthening needs.
Yeah, I think that if you get to do a limblengthening surgery, to be honest, you have to research, you have to know. This is not going to be easy. Yeah. That's it. But you have to be positive. Okay, yeah. That's totally true. You have to be positive. Stay in the safe zone. Don't risk too much your body. I love the Precice, bro. To be honest, I love the Precice, and I hope in the near future people can make, they can build like a new Precice with weight bearing, fully weight bearing, will be awesome. I heard with the people here, with my friends, I made a lot of friends, that TBI is it's harder, it's more painful than the femur.
For me, was also like that.
Yeah,
so it was really hard.
Yeah, and also because but I think doing femur is safe, it's more safety.
But for me, it's more interesting, bro. You go to university, you study the human anatomy, right?
Yeah.
So some people say if you do the limb lengthening, it will change your body and you will be never the same person as before. I don't know because of what. Some people saying no, your legs will never the same as before. And what do you think about that topic as a surgeon, bro?
I think, that of course it's going to change your body. Of course, the biomechanics are going to change because, before my legs were here, now are here. So yes, something is going to change. But the body is amazing. It can adapt. It can be adapted, and it's going to adapt. But if you don't over lengthen, if you don't get infections, if you have a good bone healing, you don't smoke, bro. That's so important.
Really important.
You don't smoke. If you don't eat, too much sugar, I think that it's not going to change many things. You're going to be able to do a lot of things. Of course, if my job is to be a soccer player and I play in Manchester United or Manchester City, of course, I'm not going to do a limb lengthening surgery. Of course, no, of course, you don't need it. Even if you are short, maybe you can do it after that retire.
Yeah, exactly.
But not before, because of course it's going to change your work, your job is going to change. But what is to be like 100%? I'm not like. I like to dance, I like to do swimming, I like to jog, I like to run. I'm going to do those things again. I know that I'm going to do those things again. But if I'm a professional like football player, of course, I'm not going to suggest, okay, do it in the time that you are a famous player, because maybe after. But I think that you can get to your normal body after a few months, after the bone healing, after removal of the precise of the nail, you can get your body like 100%. Yeah. It's going to be hard,
of course.
And as more you lengthen, it's going to be harder. That's why if you over lengthen, you can get complications.
Yeah, this is because if the muscle adaptation will lose,
yeah,
bone is tall, muscle is short, that's really a problem.
Yeah.
Also, as you said, as a surgeon, the human body is really phenomenal, man. It's amazing. Human body. It's really. We have also other doctors, guys. For example, a cardiologist in the building. Also, he's also doing the surgery. Also, he said, limblengthening surgery. If the doctor is good and everything is good, it's an amazing surgery.
It is.
But yeah, bro. So back to the as a patient, the view. You know what I mean. So you reach your goal. What do you think? What exactly will change in your life now?
Well, I'm leaving in 2 days to Peru, so I just saw my cousin, like he arrived here like a few days ago, and the first thing when we were in Peru, he was a little bit taller than me. Now I'm taller than him. He was like, oh my God, what's going on? Like he's like, he still is getting used to he's getting used to see me like a little bit up. But I didn't do this surgery for comparing to people, to comparing with my cousin, I only did this surgery because I wanted to feel like better. That's it. Okay. This is not for compare to these people, to compare to the other. I don't like those kind of things. It's just for me, more confident. That's it. I don't want to be the tallest guy. I'm not going to be the shortest guy. I'm going to be just an average guy. That's it.
Now you feel
good. I feel really good because I feel the shorter. My life was very good. I was happy. I felt that something was missing in my height, so I said, okay, maybe with 5 or 6, we can fix it, and I did that. If you do this surgery, it's not to compare with people. It's just for you, because this surgery is just for you.
Can you recommend the surgery as a surgeon inpatient?
Yeah, I recommend the surgery to go to a safe place, to go with a good doctor, and do not over lengthen. That's
Thank you. You have many friends, also doctor friends, and what was the reason, because you make also research before the surgery, what was the reason to choose Livelifetaller to choose this place as a surgeon for your limb lengthening journey?
As I told you in the first appointment, to get the 360 system, you have physio, you have the place, the building, you have friends, you have the kitchen. So you only need to feel comfortable. You have the feed, you have the makeup, you have everything in the same place. That's the reason. and also because I trust Dr. Halil's work,
That was the next question. What do you think about his orthopedic
Yeah,
work?
I think that he's really good. I think that he's really good. And actually, I like it. I like that you continue the follow-up. Okay, I'm going to finish with you, Tony, today. We're going to continue with the patient. No, we're not going to abandon you. That's so important to do follow-up of the patient. Yeah, in the time.
Thank you, my friend. I really, really appreciate that. Thank you for the video. Thank you for your advice. I have one more question, bro. Do you miss to operating?
I miss a lot,
Yeah.
Yes, I miss like my job. I miss my home.
Okay.
I miss everything. So that's why I decided to do like a fast lengthening. Fast. I'm going to get my dream.
Okay.
Get my 5, 6 centimeters more. I have to work in January, bro. I have to work in 2 weeks. I have to get back to work.
Okay. What is your first surgery in your schedule?
Rhinoplasty.
Wow. Okay. So, but by the way, bro, I really appreciate it, and also you show people's, because you are the guy who's doing rhinoplasty. You have also some patients, they trust in you, because the trust in the surgeon is really important. I mean, at the end, I trust my life to you.
Yeah.
You trust your life to Halil. Dr. Halil, greetings to him, by the way. And it's really amazing that you are a surgeon, but at the same time, you also did some plastic surgery.
We're humans, bro.
This is really good. Also, I mean, as a patient, when I see the video, oh my God, he's a plastic surgeon, but he also did some plastic surgery. I mean, like cosmetic surgery. I'm sorry, and that is a point which I'm more confident with you, because you are not only the guy who recommends something. Also, hey, look, I also did this point, and bro, I really appreciate it, man. You are an amazing surgeon, and
Thank you.
I wish you the best for your future.
Thank you.
And guys, thank you for watching our videos. It was really also interesting to me to ask a guy or person who is a surgeon and patient at the same time, because I'm a patient, but I'm not a surgeon. It's a really hard job. I respect you guys. Now we have one more thing to check the photo before and after. We didn't check that, bro. Thank you. This is Livelifetaller, and now we will enjoy the before after picture. Look at this. And bro, to be honest, your legs is looking completely different.
Yeah.
Before it looks like really crazy.
I'm really happy.
Congratulations. See you. Bye bye. Thank you, bro. I really appreciate it.